Hi, everyone. Thank you all for joining our webinar, Digitized Prior Authorization with Salesforce Health Cloud with Realties. I'm going to give it a few more minutes before we get started, wait for others to join. So just bear with us and we'll get started here shortly. Okay, so I'm going to go ahead and introduce myself. I'm going to introduce our speaker and our session, and I'm going to allow him to take it away. So, hi, my name is Lauren Frazier. I'm the head of marketing here at Realties, and I want to thank everyone for joining our session, Digitize Prior Authorization with Salesforce Health Cloud. I want to go ahead and introduce our speaker, AJ Tyagi. He's the CEO of our company here at Realties. And he's got lots of experience and has a great presentation for you guys prepared today. So I'll go ahead and pass it on to you, AJ, and you can take it away.
Perfect. Thank you so much, Lauren, and good morning, good afternoon, and good evening, everyone. Today's topic that we want to cover up is digitized prior authorization, and I'll just walk you through just a quick overview of who we are, what we do. Realtus Technologies is a global organization. We have a partnership with various enterprise applications, whether it's SAP, Salesforce, the technology for which we have the webinar today. We are a partner with AWS, Microsoft, and multiple other organizations who provide software services within the enterprise space. We very proudly serve our customers globally, which are Fortune 100, 500 customers, and we have presence in the US, India, Canada, UAE, and Singapore. So a lot of capabilities in terms of all the technologies that you see on the screen, and definitely a lot beyond the ones that is visible right now. So let's jump right into the prior authorizations. We all know that in today's medical device industry, one of the biggest challenge is to have the right set of information at the right time to provide to the providers, to the insurance organizations, to be able to go ahead and do the right prior authorization at the right time. And there's a lot of challenges that the industry faces in terms of making sure that the patients get the right prior authorization information, and also their authorizations get approved in the right manner. So I think some of the challenges that we have seen when we're working with medical device organizations or insurance companies or providers is there's a delayed treatment to patients because of the delay that happens during the prior authorization process. So we know that it's a process that takes a lot of steps. There's a lot of documentation that is needed. There's a lot of complex forms or information that needs to be filled sometimes in today's world also pretty much on paper. So there is definitely a documentation effort of complex codes and information that someone who is a very informed or intelligent healthcare physician has to go ahead and fill. And then that all takes away kind of the medical device or the medical capability of the staff and the team members who are working on this prior authorization entire administration. So there are a lot of challenges in terms of, obviously, one of the biggest challenges getting the right treatment to the patient at the right time, and not to mention the whole silos that gets created during the process. So we've been working with various medtech organizations, various organizations within US, within the Indian subcontinent, and we have identified that these problems remain common. These problems remain very very similar. Definitely, the forms, the requirements, the compliance, like the way we have at HIPAA, lot of other compliance are needed in these processes, but at the same time, there are challenges that they're very well-known challenges that can be easily improved or can be reduced, so to say, or can be taken care by implementing a digital prior authorization process. And that's what we're going to cover today, and how a prior authorization using the Salesforce Health Cloud can take care of some of these challenges that are pretty much across the industry in healthcare for related to the prior authorization process. So this slide actually talks about the various stakeholders and speaks about the various roles that we have in a typical prior authorization process. What you see on the left-hand side is you have the patient who is in need of a prior authorization. We have providers, we have medical directors, third-party or administrative law professionals, and the facility, the hospital, the pharmacy, or the actual healthcare facility that is actually requesting or where the actual treatment will happen. So let's take from left to right. A patient visits a doctor in a clinic or a hospital. The physician gathers documentations and prepares for the prior authorization. That itself is a pretty lengthy process because sometimes a lot of back and forth will happen. There'll be information that the prior provider will ask for patients they might not have. They might have to have alternate documentation. So that itself takes a bit of a time. This can be digitized using the Health Cloud from Salesforce. That submitted documentation then goes to step 3, where a benefit manager will review it. He can either deny or he can approve. Typically, there are challenges in terms of documentations in the first phase, and then you will have a denial. That goes again to the physician's office, and the physician can either accept the denial or they can request an appeal. And when they do an appeal, again, there can be a denial, and then again, there's a need of documentation. And then finally, we go ahead and do an external appeal to an external provider. And then that goes ahead and gets approved by an external provider. And finally, the health prior authorization is obtained, and then the facility can actually go ahead and complete the procedure. So you can see that within this simple step, there are just so many complications that can happen. There's so many stakeholders who are involved. There's so many paper and the documentation that needs to be exchanged. There's so many compliance codes that needs to be in. That every pretty much team member or the stakeholders in this particular so to say process needs to make sure that they are in compliance with all the information. And when we work with all the medtech industries, we work with healthcare facilities, we realized that one of the biggest challenge for them was the ones that we talked about in the previous slide, taking care of the patient's treatment as fast as possible, making sure that they have a good experience so that they continue to use the product and the services from the facility, and also reduce the load or the workload of excessive documentation, and also make sure there's a lot of transparency throughout the process so that there's no duplicate documentation happening. Everybody within the department of the prior authorization or benefit administration is aware of what's happening in the particular case and what's the milestones that are being achieved in the process. So if you do not have a typical digital solution, then this is a typical process of prior authorization that will take around anywhere between 4 to 6 weeks. Sometimes it's even beyond 8 weeks as well. Ideally, a digital prior authorization shouldn't be the one that we just talked about. It should be a very seamless process. It should be a transparent process, and it should be a process where everybody's on the same page as far as the information of the patient, information that is submitted about the patient in terms of their benefit plans, in terms of their insurance documentations, in terms of what their coverage is, what is covered, what is not covered. So all that process can be made transparent, can be made simplified, and we did it for various organizations in the medtech industry, in the pharmacy, in the hospital, in the overall healthcare industry. We worked with these users, we collaborated together, and we implemented the simplified digital prior authorization process in the health cloud of Salesforce. So a typical scenario would be a patient will visit a doctor or a clinic or hospital. The physician gathers documentations and prepares submissions. This is visible to the patient, and this is visible to actually the physician's office as well. If you have office admins, you have got physicians, you have a big facility, you've got multiple locations of the same facility. That transparent process ensures that the patient visits anywhere, you have that documentation at a central process using the utilization management of the Salesforce Health Cloud. The medical manager, the benefit manager can actually go ahead and can log into the central process, and they can actually review the documentation. They can, within the system, they can provide the approval or rejection. If it comes as a paper, then again, it's a central place against that patient. You can validate the benefit verification. You can do the benefit verification. You can also approve and manually update that information as per the approval or the denial that is being received from the benefit manager. The moment you get the approval, then the healthcare facility can start the treatment. So, and all this process obviously would involve sometimes a rejection. It also involves sometimes an appeal. Again, the whole process in a digitized prior authorization is digitally managed within the same landscape, on the same record, for the same person, using the same set of documentation, and there's no duplication of the documentation. That ensures number one challenge addresses that having a good patient satisfaction. So one of the biggest challenge patient could have is they have to be requested multiple times the documentation. This process ensures everybody understands what documentation and each of these stakeholders have. And similarly, the patients also have visibility into the approval or the denial as well. So they have a visibility into not just the documentation as well as the outcome of the prior authorization. So the patient satisfaction is taken care of. The multiple documentation that needs to be there, that is taken care. And last but not the least, there is a dedicated focus of the staff within the medical, within the prior authorization administration team that has an individual record for a patient and have information across the entire process related to that patient at a central place, in the digital process. So a typical time from 4 to 8 weeks with this process, and obviously this is a simplified view of the overall process, but it will reduce from somewhere from 4 weeks or 8 weeks to a week or 2 weeks of effort because of the transparency, because of everything at a central place in the Salesforce Health Cloud. I wanted to put this slide to talk about typically what the Salesforce Health Cloud is in general. It covers a huge set of features as a platform. Our certified consultants who are certified in Health Cloud have pretty much worked across the various verticals within the Health Cloud, whether it's provider management, whether it's benefit administration, contact tracing, very, very relevant for COVID, and the intelligent sales for MedTech, whether it's intelligent scheduling, whether it's integration with the medical record systems or various facilities, and obviously the patient services that includes setting up goals for the patients, tracking their tasks to achieve those goals for the patients, and doing the entire clinical management in addition to providing the prior authorization for the overall therapy. There are dedicated segments and data models for the provider, for MedTech, for the pharmaceutical organizations. And last but not the least, the whole beautiful package comes in built with Sales Cloud and Service Cloud that enables to make sure that you get the benefit of all the or your initial investments that you have done for existing customers of Salesforce, whether they are Salesforce customers, Sales Cloud customers, or Service Cloud customers. And all these features, especially for companies who want to sell their healthcare products or medical devices companies, they can actually use a marketing cloud that again is built on top of the Health Cloud. If any organization wants to implement Health Cloud, it comes as a package. You need to have specific licenses. And obviously there is the typical Salesforce capability of API first and mobile first. You can leverage Salesforce One X as a platform, and you can also use all the inbuilt REST APIs to connect it with any of the other systems. So very, very powerful analytics on top with intelligence and a very detailed frame of various verticals of dedicated uh, dedicated feature sets in the medical device. We are going to talk about the utilization referral management, which covers up the entire prior authorization process. And Salesforce has this module within the Health Cloud that enables all the organizations to leverage the excellent capabilities and the features of the Health Cloud platform and enable the entire benefit administration, the entire documentation, the digitization of the prior authorization end to end, while defining the goals, the milestones for each and every process. There are AI-based, artificial intelligence-based SLA trackers. If you want to really go behind tracking that within your process should be completed and you have compliance and SLAs for your prior authorization, that's also part of the utilization management module of the Salesforce Health Cloud. Since we're talking about Salesforce, we definitely want to talk about the data model. This is the data model that our team work with various organizations to ensure that that there is a standard feature. What you see at the bottom are standard Salesforce objects and the Health Cloud objects, and they work in tandem to ensure that we have a good capability to take care of the entire prior authorization process. And Salesforce does come with this data model already. It's a pre-built model. You can just download it into your org and you can start using it and keep building on top of it. Everything starts with a case object that is related to the care request object, and that covers up the member plans, what the insurance plans of the members are, any clinical service requests that they have related to the user. And then you have the reviewers also who can, in a central view, they can review it. If there are multiple line items that need a prior authorization, have the care request items. If there are certain diagnoses that have been done for the patient that needs to be considered at the time of prior authorization, you have care diagnosis. If there are drugs related information, code sets, the entire healthcare provider information, all the documentation, the health facility, and also the tracked communication details. That also talks about the email integration within the utilization data model of the Health Cloud. So we actually kept the care request as a separate object just to highlight on this slide, because this is the heart of the engine pretty much to take care of the entire end-to-end process of the prior authorization. So this is a model that is utilized in standard healthcare Salesforce Health Cloud to be able to go ahead and implement and digitize the entire prior authorization process. There are various alliances. Obviously, Salesforce Health Cloud is a phenomenal product as far as managing the healthcare industry requirements are concerned, not just prior authorization, but whether it's clinical management, whether it's medical program management, whether it's digital signature management. They're just capabilities after capability that are available, but there's always requirement to go ahead and integrate the Salesforce Health Cloud system with the third party or maybe any other third party solution. So for providers, for submission, review, and escalations, you have FHIR compliance, which is again a capability within the integration features. You have HL7, which is an industry standard for information exchange within healthcare systems and OData services as well. And obviously for patients, you have a documentation management and also a detailed access to the end-to-end process. There are capabilities in which organizations can leverage these integration platforms to exchange information with their with their providers, with the physicians, and it can have a seamless integration within the same Health Cloud environment against that particular patient and the facility. So I think the capabilities overall, even with the integration, are pretty much limitless. Now let's talk about the benefits. What benefits do we get when we do the prior authorization of Salesforce. And I think these are some of the very verified benefits that we had achieved with some of our customers. There's definitely an increased patient satisfaction. When we say patient satisfaction, like I mentioned, there's always, when you're for a therapy, you're applying for a therapy, and you want to go ahead and have a prior authorization. Patient wants to have that clear visibility into what's going on, how long will it take. They want fast outcome. They want to make sure that the prior authorizations get approved. They are being contacted for the information at once whenever there is an information that is needed. So this whole process and the transparency brings that the higher level of satisfaction for each and every patient. The physicians are on the same page. They are on the same page. The prior authorization team is on the same page. As far as the benefit administration team is also on the same page. So everybody is sharing the same information with the patients, and they're very satisfied with the information that is very similar from various channels that they are receiving. Obviously, there is a reduced workload. We are not moving papers here. Everything is digital. There's a defined workflow for end-to-end, and everybody knows what that workflow would be, and each stage can be configured within the Health Cloud. Benefits, obviously, we have the integrations into benefit verifications, and the most powerful tool is the analytics for payers and providers. If clients or customers who have Tableau licenses, Tableau is obviously an integrated product within Salesforce. They can leverage the capabilities of a Tableau, or they can leverage the capabilities of Power BI. If you're a Microsoft Power BI user, you can integrate Salesforce data within the Power BI, or you can use inherent, the out-of-the-box reporting capabilities of Health Cloud. Health Cloud does come with its own set of reports, which are very specific to the healthcare industry, but you do need a Tableau license to be able to go ahead, or Einstein license to be able to go ahead and access those Health Cloud-based features. Obviously, there are just tons of easy data or documentation access that is seamless across the various stakeholders within the entire process. Now, we talked about the whole digital process. We talked about the how it can be done, but why Realtus? As an organization, Realtus is a certified partner with Salesforce. We are a consulting partner. We are also MSP partner, managed service provider partner. The organization has tons of experience as far as SAP and Salesforce Health Cloud enterprise engagements are concerned. The whole architecture, if you see that we have within the organization, is what we call it as a digital enterprise model, which is powered by our capabilities and our expertise of certified Salesforce consultants working across the globe in Singapore, in US, and across the regions. And they have a strong team that helps them to kind of define and design the software solution with a great team of software architectures and the PMP and Scrum certified project managers that actually builds our overall technical experience. So I think as an organization, we have implemented Health Cloud solutions for medical device industries, for across the industry, helping them automate their process of appointment management, prior authorizations, entire patient journeys, documentations as far as their clinical processes are concerned, and our experts, certified experts, can help you and anyone who is interested to explore further in this topic. With that, I'll just like to thank everyone for their time today, and thank you for joining again. It's something that we definitely want to keep sharing with larger audiences as we keep moving forward. And I'll pass it on to Lauren for any questions. If anyone has, I'm happy to answer.
Thank you so much, AJ. This is a really great presentation. I hope everyone was able to take away some great information and points as it relates to digitalizing the prior authorization process. We are opening the floor for any questions. So if you have any Any questions specific for AJ? Go ahead and drop them in the chat. Okay, it looks like we have one question. AJ, can you explain a bit about HIPAA compliance with Salesforce?
Yeah. So I think that's a great question from a compliance point of view. Salesforce does have HIPAA compliance as far as the product is concerned. There are a few features that you have to consider, and when it comes to all security, personal data information security. So the short answer is yes, it's HIPAA compliant. If you want to talk about the marketing piece, Marketing Cloud is still working towards, but Pardot is already kind of a HIPAA compliant product. So I think those things we need to consider, and happy to get in touch in case you want to talk about what is Shield, how we do a field level security, how do we go ahead and take care of the dynamic page navigation so that we ensure that certain information is shown only to the relevant group of people. But yeah, I mean, it's a certified product as far as HIPAA is concerned. Okay, it seems, Lauren, you're on mute.
Sorry. So thank you so much for that answer, AJ. I'm going to leave it open just another minute or two for anyone else that has questions. If you do have a question or you think of something after the session is over, of course, you can email us at sales@realties.com, and someone from our team will get back to you with an answer. In the meantime, it doesn't look like anybody's asking any more questions. So I would just like to thank everyone for joining us and taking the time out of your day, your evening to be a part of this presentation. And make sure to follow us on our LinkedIn for further information and thought leadership pieces as we put them up daily. Have a great afternoon, morning, and evening.
Thank you, everyone. Thank you, Lauren.
Thank you.